As the state continues reopening and cases begin to rise, there is more uncertainty around the coronavirus. And today I'm joined by Dr. Dean Winslow with Stanford Healthcare. Dr. Winslow, what do we know about the steroid dexamethasone that researchers say reduces the risk of death in COVID patients?
Dexamethasone is a very potent analog, essentially, of cortisone, which is produced by our own body. So it has very potent anti-inflammatory effects as well as immune suppressive effects. So it definitely is what we would think of as a double-edged sword. The data from this large British study that press release came out earlier this week, I think is very encouraging, but it was also very clear that the only patients that benefited with COVID-19 infection are people who were already pretty sick and requiring oxygen. So it reduced, I think, the mortality rate by about 30% or so in people who were already on ventilators, and probably by 20% or so in people who were requiring supplemental oxygen. However, it was also, though, if you dig into the data a little bit from what was presented, it appeared to, if anything, very slightly increase the risk of death in people with more mild infections. So again, I think this is something we're going to be learning about as to how to properly use dexamethasone and potentially other immunosuppressive drugs as adjunctive treatment to remdesivir and other antivirals to treat COVID-19 infection. We've actually used drugs like dexamethasone and prednisone for many years in treatment of a variety of inflammatory conditions. So, autoimmune diseases like rheumatoid arthritis and systemic lupus, diseases that you may have heard about. And we've also tried them for many years in various types of infections. And honestly, the results of those experiences have been somewhat mixed, because they are suppressing the immune system, that potentially they have big downsides. Plus, they also have other adverse effects, including raising the blood sugar and making people potentially more susceptible to other types of infections.
Dining out is resuming in the Bay Area. We know that, mostly outdoors for now. So how much higher is the risk of catching COVID inside a building versus outside?
So again, this is an issue that we know that the virus is mainly spread by both large particle droplets and small particle aerosols. It's gotten increasing attention over the last few weeks. One of the basic advantages you have in the outdoor environment is that there's basically free circulation of air. So these small particle aerosols diffuse pretty quickly and are blown away. And of course, large particle droplets, if you keep, that magic 6 feet apart or greater, you're usually in pretty low risk situation. However, in indoors, you generally have an environment where there's much less efficient circulation of air. So particularly these small particle aerosols may stay suspended for quite some time in the air. And if you look just empirically about where we've seen most of the big outbreaks, they've largely been in indoor environments. And one of the classic examples, I think, was a lesson learned to all of us, was that choir practice in Skagit, Washington, where I think as many as 52 people were probably infected by one person. And again, that was a choir rehearsal that was held indoors, where actually people apparently did maintain a good 6 feet of distance between each other, and yet large numbers of people were infected, probably from one index patient. So again, the outdoor environment just by itself, really markedly reduces the risk of acquiring infection. Another just kind of principle is, and I think of this in maybe oversimplified terms, but the risk of becoming infected with SARS-CoV-2 is sort of a product of the concentration of virus that you're exposed to multiplied by the time that you're exposed. Again, reducing the inoculum, so to speak, by the outdoor environment, is one of the things that, reduces the risk of infection.
Another new study shows that flushing the toilet could spread the coronavirus. Is it really that much of a risk?
As far as I know, there have been no outbreaks, related to, use of public toilet facilities. But it is a small, I guess, theoretical concern. And I went back and looked at this very nice paper by I believe a woman scientist at UCSD who had actually studied the kind of the aerosols that are generated, particularly by the large public toilets. So I think again the advice to, if possible, if there is a lid to close before flushing the toilet, that's probably a good idea. Again, because it has been shown that SARS-CoV-2 can be shed in the stool, although probably in much lower concentrations than are present in respiratory secretions. And as I said, I think it's the most important thing is, wash your hands before and after, using any type of a public facility, whether it's a bathroom or, a door anywhere, I think is reasonably good advice. But again, I think it's more of a theoretical concern than, an actual big risk at this point.
What does Governor Newsom's statewide mask mandate mean for Californians?
Well, I think again, it's a fairly painless and very well supported scientifically approach to reduce the transmission of coronavirus. And again, remember the purpose of wearing a face mask or covering is not to protect the wearer; it's actually to protect other people. If you happen to be someone who's shedding SARS-CoV-2 and has no symptoms. And again, the science behind this is that even a fairly simple low-tech cloth face covering, if it's fit reasonably properly, will markedly reduce the ability for you to generate virus-containing aerosols, which we know are produced from talking or singing or things like that. So again, I think until we really have flattened the curve, which we've not done yet. In fact, cases are starting to uptick in areas where they've relaxed perhaps the mitigating measures too soon. It's very concerning that we're seeing both an uptick in cases and hospitalizations. So I think Governor Newsom's order makes a lot of sense and is based on pretty good science.
Do you think a second COVID-19 wave likely to happen, and how are California health officials preparing for it?
I think it's very concerning to public health officials. First of all, we really are not, anywhere near through the first wave, and it's very concerning to many of us. Just following the data that's put out every day from public health departments and the CDC, that we're actually, if anything, seeing upticks in the numbers of both cases and, more concerningly, hospitalizations in areas that have opened up very quickly. So this is the disease where, based on its transmissibility, that you're not going to have, quote, herd immunity. People use that term a lot until at least probably 60 or 70% of the population is immune. And this is a disease that's very severe, has a very high mortality rate. Again, it's very concerning that with this uptick in cases that we will see kind of the first wave actually merging into a second wave if we open up things in a careless manner.
Dr. Dean Winslow of Stanford Healthcare, thank you.